into the ground, flexing the groin muscles like you're trying to bring your leg into the middle of your body. Hold it there for about 3 to 5 seconds, then relax it, and then see if you can extend the leg out further or abduct the leg out further away from the middle of the body. You can do that for about 6 to 10 cycles where you push down. I like to breathe out, pull the pelvis under, give it a nice stable anchor point to flex that muscle from, and then breathe in, sink forward, and then push the leg out and away. Now remember, the orientation of the pelvis in relationship to that femur is going to dictate what sets of muscles you're going to stretch. Oftentimes the tight side has tighter short fibers, and again, not so tight fat fibers or long fibers. So either way, we want to know that we can get the leg away from the body into abduction about 40 degrees or 30 degrees without any additional rotation of the pelvis. So use that as your landmark to determine what side, or in determining how far out you're moving that leg. Now that we've done the groin muscles, and Ryan, you can come out, we're going to go into the abductor or external rotators on the opposite hemisphere. So what we know is that if the muscles are tight on the groin and we get an internal sweep of the pelvis on the opposite hemisphere, the muscles on that femur, on that opposite hemisphere, have a tendency to be tight on the external rotators, or again, the glute max, the deeper 5 external rotators, and the piriformis. So in order to stretch that, we have to do the opposite action of posterior tilt and, again, external rotation, which would be, again, anterior tilt, flexion, and adduction of that leg. So Ryan's going to do that by getting into all fours. He's going to pull his left leg across the midline of the body so that the kneecap is just adjacent to his sternum, and his toes are going to be internally rotated. So he's going to allow the tibia to rotate inward by pulling the foot inward. Now from there, he's going to extend his right arm in front of him, bring it out and towards the middle of the body. So he's going to create, again, some lateral pressure there. And then he's going to pull his left arm out and away. Now, if he doesn't have that balance point, he can always put his hand off to the side, but the goal here is to keep the shoulder in retraction on the left side. Now, the goal, once again, is to exert some medial pressure in the opposite hip, so his right hip should be pulled down toward